Hi, welcome to Case of the Day. Today is a new Monday, a new week, and we are on our 37th case. And this is a biopsy case where I'm discussing hydrodissection and bending the needle tip to get to the node. This 81-year-old was treated for CA stomach, came for a routine PET CT. This node was found in the para-aortic region on the left side. At least here, it seems quite easy to biopsy, a straight route, no issues, etc. But when we took the patient on table, because of his asthenic build, suddenly the lungs were in the way. There is a path here between the lung and between the pleura and the vertebral body. And so I knew I would get in there. But to make sure that there was no issue, I injected about 10 cc of lignocaine at this point to create this amount of space. And I used a 20 gauge cook with a 10 millimeter throw. But when I did that, what happened is just because I wanted to make sure that I didn't really go through the lung, the curvature past the vertebral body was such that when I deployed the gun, I was in the medial third of the node, and I wanted to be in the center. And so I bent the tray or the needle tip by about 15 degrees. So now you can see that it is pointing laterally and it is through the middle third of the node. Now, bending the needle tip, you can't do a lot because then it doesn't go through the cannula. But you can do this up to 15 degrees. And for those who are interested in the technique, I had two cases where I discussed this at ctbiopsy.com, 104 and I think this is 90, but if you just search for it, you'll find it. Case 90. And these are all free to view currently. Hydrodissection is more commonly used by everyone. You inject saline or lignocaine, create a bit of a safe space. Here is one case where I created space in the parasternal region. Sometimes you just use it to push the vessel away, in this case, the internal mammary. But the most common use for me is when I'm biopsying subcarinal nodes and I create a space between the pleura and the vertebral body for an extrapleural approach. But this case shows how we can combine different techniques to safely get to specific parts of the body. And we'll get an answer in 3 to 4 days, and I'll put up a YouTube post with the answer. So, in short, a combination of hydrodissection and bending the needle tip can help us get into difficult areas during biopsies. This may be of interest to some of you. We're doing, as part of the REF, a leadership course on the 21st of June on Saturday, if anyone's interested. That's my WhatsApp channel, and thank you so much for viewing this.